Welcome to this edition of the Designs for Health audio science article.
Reduced glucose tolerance has long been recognized as a potential risk factor for Parkinson's disease, and yet there is increasing scrutiny of insulin resistance as a pathologic driver of neurodegeneration. That's a simple sentence with profound implications. It's increasingly recognized that insulin resistance or chronic hyperinsulinemia are major risk factors for cognitive impairment and Alzheimer's disease. A neuronal energy deficit, or a reduction in neurons' ability to metabolize glucose, leads to neuronal atrophy and eventually the clinical signs and symptoms of Alzheimer's. An emerging body of research suggests that other neurodegenerative conditions, especially Parkinson's disease, may have similar etiology. In the case of Parkinson's disease, or PD for short, the cells most affected would be dopamine-secreting neurons. A new study looking at insulin resistance in Parkinson's disease patients has revealed that IR among those with PD may be much higher than was previously realized. The study was small, just 154 subjects, of which 109 were males and 45 were females, with an average age of 68 years, but it's worth paying attention to. Despite normal fasting glucose, and in many cases also normal hemoglobin A1C, over half of the subjects, at 58.4%, had undiagnosed insulin resistance. Insulin resistance was found more frequently in overweight and obese subjects, 61.1% and 82.8% respectively, but even among quote-unquote normal weight subjects, 41% were found to be insulin resistant. The mean homeostatic model assessment of insulin resistance, or HOMA-IR for short, in the cohort was 2.3 plus or minus 1.8. Some medical professionals consider insulin levels less than 1 to indicate optimal insulin sensitivity, with a score greater than 1.9 indicating early insulin resistance and greater than 2.9 indicating significant resistance. So several of these subjects fell squarely over the threshold of insulin resistance. In this study, insulin resistance was defined as a HOMA-IR greater than or equal to 2.0, or hemoglobin A1C levels greater than or equal to 5.7. It's crucial to note that all subjects in this study were not diagnosed as having type 2 diabetes. So, there was a substantial proportion of Parkinson's patients with peripheral insulin resistance, even in the absence of type 2 diabetes. They're certainly not alone. Chronic hyperinsulinemia, even, or perhaps especially, in individuals with normal blood sugar, appears to be a driving factor in a host of modern, chronic, non-communicable diseases. This cannot be emphasized enough. There is a myopic focus solely on blood glucose with regard to metabolic health, with insulin being nearly ignored. New theories are emerging that defective insulin signaling in the central nervous system may contribute to Parkinson's pathology, and that type 2 diabetes and Parkinson's disease might have shared etiologies. The following quote from a published article in the journal Progress in Neurobiology notes, "There is growing evidence that a process analogous to peripheral insulin resistance occurs in the brains of Parkinson's disease patients, even in those without diabetes. This raises the possibility that defective insulin signaling pathways may contribute to the development of the pathological features of Parkinson's disease, and thereby suggests that the insulin signaling pathway may potentially be a novel target for disease modification. Given these growing links between PD and type 2 diabetes, it is perhaps not unsurprising that drugs used to the treatment of type 2 diabetes are amongst the most promising treatments currently being prioritized for repositioning a possible novel treatment for Parkinson's disease, and several clinical trials are underway." Again, we see recognition of the fact that insulin resistance, even when blood sugar is normal and individuals are not diagnosed diabetics, may be a pathological factor in neurodegeneration. The lead investigator of the study assessing the extent of insulin resistance in Parkinson's patients states, "Now that, for the first time, we understand how common insulin resistance is in non-diabetic patients with Parkinson's, we can begin to address this public health challenge. This increases the importance of finding new treatments and lifestyle interventions that can address this metabolic dysfunction with multiple implications, from diabetes to neurodegenerative disorders like Parkinson's disease and Alzheimer's disease." Indeed. If insulin resistance is a major contributor to the pathology of neurodegenerative conditions, then it stands to reason that dietary and lifestyle interventions that reduce insulin levels may be beneficial for people living with these. Promising research is already underway looking at ketogenic diets as a nutritional therapy for Parkinson's disease, and there may be a role for other adjunctive strategies such as fasting and increased physical activity. It will be interesting to keep an eye on related research in the future. Perhaps diet and lifestyle changes can make inroads in these otherwise devastating and difficult to treat illnesses.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.